So how do I look?
Fabulous.
No, I'm not fishing for compliments, Brittany. I'm actually wondering how your vision is. Am I a little out of focus? Maybe there's something blocking your view from the inside of your eyes.
There are often common problems that lead to us needing to wear glasses or contacts. Both of us know that. And that means always having to reach for something to help us see clearer no matter where we are or what we're doing. So I recently sat down with Dr. John Berdahl at Vance Thompson Vision to talk with him about the options in refractive eye surgery, which can have you seeing clearer without always having to reach for the specs or the saline solution. Thanks, Dr. Berdahl, for having us out here to Vance Thompson Vision.
It's great to have you back.
So start off by explaining what refractive surgery is and the difference between refractive surgery and LASIK, if there is one.
Okay, so refractive surgery is a category. It's surgery that we're doing to change your refraction so you don't have to wear glasses. LASIK is the most common surgery in that category, but there's a number of different options that are refractive surgeries with the intent to help people be less dependent on their glasses.
So what are some options for refractive surgery?
So LASIK is probably 75% of the refractive surgery that we do. PRK, which stands for photorefractive keratectomy, is probably the other 20%, and then there's a number of other procedures that I'll get into in just a second that make up the vast minority. PRK is when, instead of making a flap like we do with LASIK, we remove the surface cells on the cornea, and then we change the shape of your cornea so that the refractive error is now gone and you wouldn't need glasses. And the difference there is you need to heal that up. And so that takes a little bit longer, and the recovery is uncomfortable for a couple of days, where LASIK, the recovery is uncomfortable for a couple of hours typically. So those make up the majority of refractive surgery. But then there's implantable contact lenses. There's little incisions we can make in the cornea to try and get rid of astigmatism. And then when we do cataract surgery, we can also fix refractive errors too. And so that's kind of a hybrid between cataract surgery and refractive surgery.
Okay, so how do I know if I'm a candidate for this?
Yeah, so with all the tools that we have available, most people are candidates. Now, and when I say most, I'm probably saying, 85 to 90% of people we can make better, but not everybody. And that's probably the most important thing to know from your doctor and your surgeon, is if you aren't a good candidate. We don't want to do surgery. We're here to make lives better, right? And that's why we exist. And so you definitely want somebody that'll tell you, hey, it's not the right thing for you, Brittany. I'm sorry, the technology isn't right for your eyes. With that said, most people are a good candidate. And the only way really to know is to get an evaluation. And evaluations are free, and you look at a whole bunch of things. You look at your corneal thickness, you look at the shape of your cornea. We try to understand your visual goals. We understand how thick your glasses are. And we put all that together to say if you're a good candidate or not.
What are some questions that patients should be asking before surgery?
Yeah, really good. So they should ask any question that's on their mind, because this is a big deal, and it's your eyes, and it's your most precious sense. So we'll take all the time necessary to answer any of those questions. But some of the really good questions, my favorite question to ask any doctor, anytime, is what would you do if it was your eyes? Or what would you do if this was your mom? And I think that cuts through a whole bunch of gobbledygook and gets to the answer pretty quickly. But the other things that I would say is, what are the downsides? What are the upsides? What are the likelihood of it, something bad happening? And then, how many procedures have you done? I think that's always a really fair question.
So now that we know everything we need to do for preparing and getting ready for this, walk me through a refractive surgery procedure and what this looks like.
Yeah, so let's do LASIK, because they're different procedures, but LASIK is the most common. So the day that you come in for your LASIK procedure, you'd be here for about an hour and a half. It could be an hour, it could be 2, depending on if there's some additional testing we need to do. The surgery portion itself probably takes about 15 minutes to get both eyes done. And so you'd come into the room, we'd give you a little bit of medication to relax a little bit, but you're awake. We'd have your choice of music on in the laser suite, so you feel comfortable. And then you'd lay down on your back and you'd be looking up. at a little blinking light. And we'd put a little stabilizing ring over your eye, and then the laser would connect with it and it creates a flap. And we do that on the other eye. And that's the first step. And that part takes for both eyes maybe 5 to 6 minutes. The flap itself only takes about 30 seconds to do on each eye. We move you over to the other laser. We lift up that flap. A different laser reshapes the cornea. We put the flap back down. We put an eyelid holder in so that you can't blink. And then the laser itself tracks any micro movements 400 times a second. So you can't really like move your eye and something bad's going to happen. And so the changing of the shape of the cornea probably takes about 10 to 20 seconds per eye. We put the flaps back down, we give you some eye drops, we tell you congratulations, and you're done.
And then what about the recovery process?
Yeah, so for LASIK, what I tell everybody is that your eyes are going to stay and burn like the dickens for about 3 hours. And then kind of like a switch, your eyes are going to feel more comfortable and your vision is going to start to come around. You will have some dryness, you will have some glare, you will have some halos. That goes away with time almost always, and if not, we'll treat it.
All right, and so am I ever going to have to wear glasses again after having this refractive procedure?
Yeah, so the short answer is yes, because as we get into our 40s, we lose our zoom vision and we can't quite see up close. And so a lot of people still don't need glasses for distance, but they do need it for up close when they get into their 40s. And that's not a failure of the LASIK, that's just the price of wisdom, because as we get older, our lens becomes stiffer. I had my LASIK now 11 years ago and haven't put on a pair of glasses since. I'm 41 now, and so probably in 4 or 5 years, I'll start to need something for that real fine up close vision. Now, there are surgical options for that too, and so so then when the time comes, we can answer that question and maybe not need it so you need readers either.
All right. Well, thank you so much, Dr. Berdahl, for joining me here today.
It's always fun. Thanks.
If you'd like to speak with any one of the experts at Vance Thompson Vision about whether refractive vision correction is for you, give them a call in Sioux Falls at 605-361-3937. You can also learn more about their other procedures by visiting VanceThompsonVision.com.